Welcome to Central Georgia Focus. I'm Fredrick Price. May is Mental Health Awareness Month. It's been observed in the U.S. since 1949. The month focuses on encouraging us to tune into our emotions and ask family and friends, how are you doing? Slow down and take time to understand what it means to be mentally healthy. So today we want to focus on year-round good mental health at all levels and talk about all of the resources available here at Macon. So our guests today are Andrea Cook, the Development Director of Macon Mental Health Matters, a Macon Violence Prevention or MVP initiative, and Jeremy Grissom, I should say, Macon Violence Prevention Coordinator. So thank you so much for being here, both of you. My first question, I ask my friends and family this all the time. How are you doing mentally?
Today I am feeling excited and hopeful about the state of Macon.
What about you, Jeremy?
I'm excited. There's a lot of new things on the horizon here, and it's, I think it's good to be in the middle of it. So I'm excited about what's next to come here.
Well, let's tell people, all about your respective roles. Andrea, you work with Mental Health Matters. Kind of tell us a little about that and what you do for the organization and the community.
So my role with Macon Mental Health Matters is project director, and we have created a program that is addressing the need for mental health services from a non-traditional perspective. And we are a barrier-free program. We try to reduce stigma by having these adjuncts to mental health services. So not only do we have counselors available to see people at no cost, we also offer no-cost yoga. We offer drum circles, which a lot of people don't understand how that can help to improve your mental health, but we encourage people to drum on a regular basis. And then we do guided meditation, we do knitting and counseling. A lot of these activities are designed specifically to help lower inhibitions about accessing mental health services. And so we have a lot of fun in this work because it's difficult to face sometimes the issues with mental health or mental illness, but really trying to show people that we are working diligently, not just our program, but many programs to make Macon the most mentally healthy city in Georgia.
Jeremy, what about you?
So as the Macon Violence Prevention Coordinator, I'm the collaborative piece between the county and the community as far as making sure that the leadership team needs meetings and reporting out, making sure that partnerships are kept well, actually making sure that, organizations such as Ms. Cooks has what they need to continue to thrive and give the community the best part of what MVP has to offer. So, I look at a lot of the data, manage some of the grantees, and make sure I get the word out about what we're actually doing with the Macon Violence Prevention Initiative.
Let's talk about the mental health initiatives that both organizations respectively are doing for the community.
So I'll start with my baby. In partnership with Macon Mental Health Matters, we started a men's mental health meetup, which we do every fourth Tuesday at Churchill's, and it just came out of a panel we had last summer, and what we found is that standing around talking after the panel, there was no place as such for men to go. Like, there's always extra effort put on what women need, but it's never that focus put on men's mental health. And so we wrestled with it, and we finally just moved forward with actually providing a space for men to go. And I think what's most unique about it is there's no expectation. What's supposed to be an hour usually turns into 2 or 3. and we give men who show up a place to just be literally. There's no expectation of time. So whatever they do, I let them know, if you decide to come in and stare out the window for an hour and a half, fine with me, because we know that probably after they leave, the responsibility is going to come right back in, and the expectation of what they need to be or who they need to serve as a husband, a father, whatever it might be. Those expectations are still waiting once they get that brief moment to just focus. And a lot of times, if you don't have time to sit, you don't really know how you're feeling. Yeah. You're surviving. You're in a mode to continue to go, but you haven't assessed how you actually feel for the day. Sometimes you've gone so much during the day. It's probably happened to you before. You hadn't even ate because you're not thinking about it. You're busy. You hadn't taken the time to do a self check. How am I feeling? It's just about the responsibility. So we saw the numbers grow, and I'm very proud of what it has become.
What about for you, Andrea?
Well, we have so many initiatives. I am incredibly proud of the men's mental health meetup because so many men tend to, take care of those pressing things. And what often people don't understand is that if you're not mentally well, nothing else is well in your life. But we've created, not in opposition or in competition with the men's mental health meetup, but we created a women's mental health meetup. It's called TNTs, and it's in partnership with Chic Culture and Ashley Monique Designs. And it meets every second Thursday.
Okay.
And our numbers are also growing. I mean, it's what we found is that creating these therapeutic groups, even if not led by a therapist, it's still therapeutic to come in and speak with people who you likely don't know have something in common with you. And so we're building community, we're building connection, and then we're decreasing people's inhibitions about accessing services. And so because we're able to do that, then we're able to direct people to services. And not just our service, but any of the mental health agencies that are serving people in Macon. One of the benefits about partnering with MVP has probably created more access to mental health services because of funding, simply because of funding. That grant program has funded more mental health agencies than probably any other initiative that's happened in Macon-Bibb County.
Well, let's talk about how Mental Health Matters really aligns with MVP's objective, if you will. How does that work?
So poverty and community violence are probably the two single most important qualifiers for whether somebody is going to have a mental health disturbance. Children who witness community violence are more likely to have incidences of or diagnoses of ADD. And what happens is through seeing community violence and domestic violence, young people act out in school. They are often targeted to be involved in gang activity because they're looking for community and connection. And so to me, it is a major part of the MVP program because we are helping to address root causes. What would you say?
Yeah, and it just covers so many areas. When you talk about all the things that, MVP covers, you talk about food insecurity, you talk about conflict resolution, you talk about all of the organizations that we have working as one team to make sure there's not a thing that a youth goes lacking. You know what I mean? So when you talk about food insecurity, when you talk about mentorship, when you talk about supervised activities, when you talk about blight, all these things, they're connected. And, how can you be prepared to focus on what your next decision is if you're hungry or if you don't have clean clothes or if you don't have somebody to talk to? And, there is that element to connect with gang activity if there's not that kind of need being met in the household or in the community. So I think it goes hand in hand, mental wellness and prevention. I think it goes hand in hand.
Yeah.
What about the mental health services in Macon? Where is it now and where could it be?
So when we started this project, Georgia overall was 51st in access to mental health services, meaning we were dead last in getting people from needing services to actually getting a counselor. Over the last few years, we are now at 48 in access, which is we have to celebrate those small wins, but in Macon-Bibb County, there's almost 160,000 people. There's 162 counselors in our city, and that there's no way that the counselors who are available can properly take care of the people who are here. And so we have to create these unique pathways for people to access services. Places like our CSB, River Edge, are able to see people without worrying about income. Our program is no cost. We don't ask about finances in any way, and so that creates an easier way for people to access services. And then places like Family Counseling Center who see people at either no cost or reduced cost. So I think that we are targeted and working towards making sure that people have easier access, But Macon, you can Google Macon, and Macon Mental Health Matters is the only program like it in the state.
Okay, we need to take a break. We're going to continue our conversation in just a moment. When we return, we're going to talk about specific free mental health services people don't know about that are available. Stay with us. Welcome back. We're talking about mental health services available in Macon, the need, and how to access those free services. So we talked about 5,300 people that have received free mental health services. The mayor talked about this in his State of the City address. When you hear about the 5,300 people that really need those services, what comes to mind when you hear something like that?
To be perfectly honest, I'm incredibly excited about the 5,300 people that we've been able to help. But what immediately comes to mind is the 50 people who are on our waiting lists, and how we can help create more access. And because anybody who asks for services, I want them to get them.
Right.
I mean, it takes a lot to get to a place where you say, I need a counselor. So I am a perfectionist, and so I really like to meet the need. So that 5,300 number is something to be proud of. But what I see when I look at our waiting list, I think about how we can do more to make sure people have easier access in their communities for getting mental health services. So yes, it's hard to not be excited, especially because our program is specifically targeted at addressing the need for people of color and people who are typically living in impoverished neighborhoods. And it takes a lot to say, especially when you're so proud, which Black people and brown people are typically very proud of, and don't always reach out. And so we've had that many people reach out and get services. So it is something to be proud of.
Those services clearly there, but not a lot of people necessarily take advantage of those services for a number of reasons. It's clearly stigmatized. Why do you think there is such a stigma?
I think there's a stigma. Sometimes it could be, what we've been taught, you know what I mean? Growing up, it could be that, it could be, just if sometimes that can feel unsafe, you know what I mean? You have no control of those environments sometimes. When you start talking to people and you start opening up, there might be some things that come out that you're not ready to address, and that's some people's fear, because I think a lot of times we just go and go and go and we don't think about it. And then when it comes out, it's hard to deal with, because I think the hardest thing that people have to do is face themselves. And with such a straight and clear line to therapeutic assistance with this program, I think that some people are just, they're not aware of how fast they're gonna get to see a counselor, or how much is gonna be brought out that quick. Usually there's a long gap in service. But with Macon Mental Health Matters, the attempt is to try to get people in service as fast as possible, or at least some sort of service where they're plugging in the gap. And I think that scares people. It happens fast.
Do you think COVID played a part in this too?
Absolutely. I think that COVID made all of us have to deal with ourselves, right? You couldn't go anywhere. Didn't matter how much makeup or how low you cut your hair or what outfit you put on, you had to face yourself. There was nowhere to go. There was nothing to do. And I think that we've saw a lot more people with mental health crises because of it, to just sit at home with nothing to do, nowhere to go, no work, no school. And I think that's why we're seeing, kind of the need for more mental health clinicians.
To your knowledge, both of you, where are some places that people can get access or receive mental health care here in Macon?
Okay, so I'm going to start with my program, of course. So with Macon Mental Health Matters, we're located at the Booker T. Washington Center. Every day of the week, Monday through Friday, you can access a counselor from 10 to 12. We have therapeutic groups happening during that time, but we also have counselors available who can talk to you. Then there's places like River Edge, And River Edge has many locations around Macon, Bibb County. And one of the places that they have is on Fulton Mill Road, and it's a crisis intervention place. You can go there whether you have income or not, 24 hours a day to get services. And then places like Family Counseling Center, and then Next Level is a program that's funded partially by MVP, and their students get access to a mental health counselor. So if you get into that program, your students are more likely, or your children are more likely to have better access to a mental health counselor than many of us in the city. And so there's just so much, and people can go to MaconMentalHealthMatters.com. Not only do we have our services listed there, but we have our partners listed. If somebody would like their information added, it's easy to get in touch with us. But also Macon-Bibb County is a really resource-rich area for people to get more services. I mean, it's in the forefront of our processes. And one of the things that I don't know that people are aware of is that through Macon Mental Health Matters and the advocacy, it's now Macon-Bibb County employees have access to a mental health day. And they also have a mental wellness event once a year where people bring their families and they can get access to resources. So it's a deliberate effort. And if somebody is incredibly interested in helping people, we're more than happy to help get people directed to programs so that they can become counselors too.
Okay, well, we're going to take another break and continue our very insightful conversation. When we come back, we're going to have more information from Mental Health Matters services and other programs that are available. We're back in a moment. Welcome back to Central Georgia Focus. We're talking about maintaining good mental health and accessible free services available in Macon at no cost. So let's talk about how these programs are really funded. Don't all go at once.
You want to talk about the ones that MVP
funds? So we funded through our general fund. We funded a lot of the grant programs, all of the grant programs at the Community Foundation of Central Georgia. So we've had 2 rounds of MVP grants, and we're working on our 3rd now. And we've essentially allowed organizations to build themselves from the ground up, and some of them provide mental health services, some don't. But the key is putting people in their own neighborhoods because they know what the need is. So obviously, moving forward, we're teaching these organizations how to look for funding outside of local, right? So we're building them in a way and giving them the capacity to say, all right, now I know how to manage a grant, right? So we provided them, the Community Foundation provided them classes on how to manage not only the grant, but the financial portion and reporting, and also how to write a proposal, the expectation of writing a proposal. So yes, we've made the first investment for 3 rounds to make sure that these organizations know that we're invested. And I think the next step is going to be finding out how to keep these programs going essentially forever, because the need is going to continue to grow. And we're excited about the knowledge that we've given them. I think a lot of these organizations have grown tremendously over the last year or 2, and I'm proud of what we've done.
Of course, funding plays a really important part here, as you just alluded to. Volunteers, though, also play an important part. Absolutely. Talk about the importance of volunteers and perhaps any opportunities for someone that's watching this that may want to volunteer with Mental Health Matters. Okay,
so our program is fully funded by Macon-Bibb County, and so we've been funded at $1.2 million so far, which is a huge investment in mental health. But as far as volunteers, we're always looking for volunteers, and a lot of our services are offered through interns, which are educated volunteers, but we can use volunteers for almost any event. Every second weekend we have a wellness weekend, whether you want to come and help check people in, or if you want to help get the grocery bags ready for people. It really is building community through volunteerism and mental health. And so they can always reach out directly to me. They can also go to our website. There's a button on there where if you want to volunteer, if you want to get involved, if you want to collaborate, we're always willing to expand our services through the help of volunteers.
We also talked about the stigma behind mental health. How can we break that? I mean, what do you think we can do as a community, as human beings?
I think that every year, Channel 13 reaches out and makes a deliberate effort to bring awareness to mental health and how people can access it. I think that it is just continuing to talk about mental health in the same way people talk about physical health, because the World Health Organization says there's no health without mental health. So continuing to talk about it, allowing people the room, space, and opportunity to talk about their own diagnoses. I have anxiety and ADHD, and so most people don't think that if you're a mental health counselor that you have a diagnosis yourself. And so I think we just have to continue to talk about it in the same way that if I had broke my foot, you would see it. And you would probably have some compassion for me because of my broken foot, but my need for information is based off of my anxiety. And so if you didn't know that I had anxiety and I just asked a lot of questions, then you might not be as compassionate with me. And so I think that we have to continue to just put these things on the forefront, and specifically when it comes to men, because women are gonna likely access services, but making it more comfortable and creating safe spaces for men to talk about things.
Yeah, I think continue to create a clear path to treatment of services. And I think you reduce the stigma by also letting people know that I think some people don't know about the privacy of it. Like there's privacy laws in place for that specifically, so nothing you say can be, divulged anywhere else. And I think also just continuing to be in those spaces and making it easy to access. If we continue to talk about it and we normalize it and we kind of remove the eyesore of what it used to be and let people know that this is what the majority of us, we're all dealing with something, no matter what it is. If you're living in this world, you're dealing with something.
That's true.
So continue to make it comfortable, continue to make it a safe place, and reduce the stigma by just talking about it, and not making it that thing you talk about in the dark.
Right.
That you let people know up front, here's what I'm experiencing.
We got about a minute left. Let's kind of recap how people, I guess, can get involved and how people can utilize these services that you all have.
Quickly, I will say this month they can go to MaconMentalHealthMatters.com, but also we're having panel discussions, lunch and learn series for the next 3 Fridays where we will have free food, but there will also be some insightful conversation. And so just please get connected with us.
Yeah, and if you want to volunteer for MVP, you can go to the Macon Violence Prevention page and sign up to be a volunteer. You can also go to the Community Foundations page and find all of the organizations that have been funded. There's a list, and there's also contact information available if you want to reach out to a certain organization to serve. And if you can't get a hold to me, both of us are connected in the work that we do, so contact one or the other, and we'll make sure we get back to you.
Jeremy, Andrea, thank you so much for this insightful conversation. It's a conversation that we're going to continue to have for the rest of our days. At least I surely hope so. Thank you all so much for watching Central Georgia Focus. We're back next time. Have a good one. We'll see you then.